So I walk into the scene. The scene is safe to myself, the patient and any bystanders. I'm wearing the appropriate PPE, which is gloves and glasses. I'm then going to introduce myself to the patient and explain why I'm here today, and also gain consent from him as well. So hi, my name is Lydia. I'm from the New South Wales Ambulance.
Hello.
How are you today?
I'm good.
That's good. I'm just going to perform a respiratory assessment on you today, so I will need to listen to your lungs and also palpate your chest just to feel for any tenderness or pain, and do some other vitals on you. Is that going to be okay for me to do that today?
It's okay.
Excellent. So I'm then going to kneel down in front of the patient so I don't seem intimidating. While I'm here, I can see that he's sitting in a position of sitting upright and is in a position of comfort. Do you feel comfortable there? You're not?
I'm comfortable.
Yeah, okay. I'd be more concerned if he was in the tripod position, which would alert me to him being in respiratory distress. As well, talking to him now, I can see that he's alert. He's well perfused. Do you mind if I just touch your arm?
Yes.
And he doesn't feel warm or anything, so I'd say his temperature, which I will take later on, will be fine. I can't see any accessory muscle use as well. While looking at his chest, I will be assessing his work of breathing. So the rate, whether he's tachypnea or bradypnea, the rhythm, whether it's irregular or regular, and the quality, so whether it's deep or shallow, and it does look to be normal at this stage. So I'm going to take your pulse rate, okay, and while I'm taking the patient's pulse rate, so I'll just grab your hand here, I'm also going to be taking the respiratory rate as well. Sometimes if you take it at the same time, the patient doesn't want to change their rate of breathing, which they can do if they know you're looking at them. So I'm going to do this over 30 seconds and then times it by 2. Okay, so his pulse rate, heart rate is 60, which is normal, and his respiratory rate is around 15, which is also normal. So also I can see that there is no presence of home oxygen. Do you have a cough at all?
Just a mild cough.
And when you cough, do you bring anything up, like any sort of sputum or anything?
No.
No? Okay. And if you did, would it be clear?
Yes.
Yeah. Okay. I'm also going to check his fingers, if I can just grab your hand there, just for any signs of clubbing, which will alert me to carbon dioxide retention. I am also looking for any nicotine staining, which would alert me to the patient being a smoker as well, which that seems to all be normal. Okay, I'm then going to inspect your chest. So in doing this, I would normally maintain patient's modesty. Being in a home environment, probably most likely be able to take the patient's shirt off because we're in an enclosed environment. But for the sake of this video, I will keep the patient's shirt on. Okay, so I'm just going to, normally I would expose the chest and just checking for, I'm just going to look down his shirt, is that alright?
That's okay.
So I'm just checking for any signs of a pacemaker, any scars, bruising, barrel chesting, which would like the hyperinflation of the lungs. Okay, I'm just going to palpate for any pain or tenderness, so just tell me if this hurts at all, okay? There? No?
No.
Okay, I'm just going to go down a bit further, is that alright?
No.
No pain?
No pain.
Okay, and now I'm just going to go from up underneath your shirt and just palpate your tummy, so let me know if there's any pain, okay?
Yes.
Any pain there?
Yeah, that's fine.
Yeah.
That's fine.
Okay, excellent. Also looking to see whether there's a symmetrical rise and fall of the chest. So I am going to auscultate, like listen to your lungs. Okay, so I would do that 3 per side, anterior and posterior. So maintaining the patient's modesty, I will be doing this down the front of the shirt and down the back of the shirt. Okay, so I just want you to breathe normally for me. So just in and out as you normally would. Okay, so I'm going to come up from underneath the shirt just to do the last one. Okay. Just sit forward for me, yeah. And just keep breathing normally for me. Just going to come up from underneath. So just breathe normally for me. Okay. So I can't hear anything abnormal there. So normally I'd be looking out for any wheezes, rhonchi or crackles, which would alert me to COPD, asthma, pleural effusion, stuff like that. I'm also going to just percuss your chest as well. So maintaining the patient's modesty, I'll most likely do that on the outside of the shirt. Normally this would be done when the chest is exposed as well. So I will be listening out for any dull sort of sounds which could alert me to tension pneumothorax or fluid on the chest. Okay, so I'm just going to tap my fingers on your chest, on the front and the back. Is that okay?
That's okay.
Okay, I'm just going to go to the back so that seems normal. Okay, just sit back for me. So after doing the respiratory assessment, I would then explain to my patients my findings. So if he was asthmatic, I'd obviously ask whether he was on any medication, that sort of thing. And I'd be able to hear like an expiratory wheeze, stuff like that. So then I'd just alert him of my findings and then give the appropriate treatment for my findings.